Our next briefing will be focusing on the Appalachian Communities Health Emergency Act, advised by Professor Callahan. So if their briefer is nearby, let's begin.
Unnecessary, but thank you. So good morning. I'm Alisha. I'm here on behalf of the Appalachian Community Health Emergency Act team, the AACT. I'm presenting our final briefing, which is the outcome of 2 semesters worth of work. Before starting, I'd like to thank my team. You've been really fabulous to work with, and I speak on behalf of all of us, Professor Callahan, when I say thank you for your guidance and your wisdom. It's been great learning with you. Okay, so today I'd like to answer a couple of key questions. First, define the problem. So what is mountain removal mining and why it's a problem? Then delve into a response to the problem and delve into the details of the AACT. And finally, the AACT implementation. So what does our program look like in terms of timeline, budget, organization, and program evaluation? And then I'll conclude. So the image you're seeing here is an aerial snapshot of Massey Energy's mountaintop removal mining operation in West Virginia. This is just to give you some context about what mountaintop removal mining looks like in the real world. And so this form of mining accounts for about 1/3 of the coal that's mined in Appalachia. And when I say Appalachia, I mean Tennessee, West Virginia, Virginia, and Kentucky. So I'm going to delve into some of the key processes that result in this final image that you're seeing here and why it's a concern for communities who reside in these places. So mountaintop removal mining is just as it sounds. It involves using explosives to remove the top of mountains to access shallow coal seams that lie just beneath the surface. And so the first process that's crucial to this overall mining process is the explosive blast process. And that involves using explosives that releases chemicals into the air that potentially jeopardizes air quality and can be inhaled by people in the surrounding communities. The second major process is called the valley fill process. So once the tops of mountains have been blown off, that has to go somewhere. And it's often deposited in local valleys, and that results in altering the ecology of the local environment and resulting in water pollution. And the third process that you should know about is the post-mining slurry process. So when coal is processed and cleaned, that chemical cocktail, or that mining slurry, is deposited in these natural kind of crevices around the environment. And they're held back by earthen dams. And what often happens in the real world is these dams either overflood or they leak through, and that results in water contamination. So as I've alluded to throughout these 3 processes, mountaintop removal mining does result in ecological damage, but more importantly, has raised a lot of concerns about human health for those residing in proximity to these places. And so this map that you're seeing up here is compiled by the Center for Disease Control. And So the red dots represent mountaintop removal mine sites in Appalachia, and the darkest blue patches that you see represent incidences. Oh, thank you. Incidences of cancer that are far above the national average. So the national average is about 165 deaths per 100,000 people, and those darkest blue patches that you see represent more than 225 deaths per 100,000 people. And so when I say deaths from cancer, more specifically, I'm talking about uterine, ovarian, and skin cancer. And we can make these graphs or these maps for a number of other health outcomes. So that's cardiovascular disease and lung disease. So these trends are emerging as research is developing that is raising a lot of red flags about the negative health outcomes associated with mountaintop removal mining. But no causal relationship has been determined yet. And so that's what the AACT is really seeking to do. And so at the core of our bill, then, is a health risk assessment. And it's supported by 3 other components. So the first being that no new mining will take place in Appalachia while this health risk assessment is being conducted, and that firms that are currently mining will have to continuously monitor their impact and also provide financial support to fund these health risk assessments. So now that I've articulated the problem and described how the AACT responds to that problem, I'm going to delve into what the AACT would look like in the real world if it were implemented. And so the first big question is, who's doing what? And so what you'll see up here is kind of our organizational chart about delegating responsibilities and key roles within our program. And so the health risk assessment would be housed under the National Institute of Environmental Health Sciences, more specifically the National Toxicology Program. And the central key player in this chart is the principal investigator. So they're the person who's putting forward a project proposal, analyzing the data, holding the team together, and is really kind of the CEO of this project. They're also supported by 3 other groups, so a local advisory committee consisting of people who reside in communities affected by mountaintop removal mining, and that's to give us some accountability and give them the opportunity to give input into research that's going to affect their livelihoods. They're also, on the opposite side, you'll see a scientific advisory committee, and that's a group of scientists who don't have a stake in our research and will give us some sort of accountability and weigh in on the process that we're putting forward. At the bottom, you'll see a contractor and subcontractor box, and that's delegated to people who are going to go in the field and collect data and do home visits. So we imagine that potential contracting groups might be universities or private consulting groups. Tying everyone together is a program coordinator. So this is a person who would make sure that information is flowing in a fluid way between groups and that we're meeting the goals and outcomes that we decided upon. And at the very top, you'll see a deputy director of science. And so ultimately, information converges to the program coordinator, who then shares it with the principal investigator. And finally, the deputy director of science kind of is a liaison between the program itself and the National Institute of Environmental Health Sciences. So next, I'm going to delve a little bit into what our program would look like on a large scale. So what you'll see up here is a 5-year plan and our program kind of overarching goals. So the first year, we're doing a lot of setting up the logistics and the framework for when we're actually running the health risk assessment. So that means planning the research, setting goals, hiring contractors. And then years 2 to 4 is when the bulk of the health risk assessment is actually being conducted. So people are going out into the field, collecting data, and we're evaluating that data as we collect it. And the very final year, year 5, is when we're amassing that data and trying to analyze it and parse out that relationship between mountaintop removal mining and adverse health outcomes. And ultimately, what will happen is the PI, the principal investigator, and their assistants will produce a final report that determines that causal relationship between mountaintop removal mining and adverse health impacts. I'm going to focus on the first year, just to give you an understanding of what might happen. And so there are four big themes or projects that will happen during the first year as we're implementing this program. The first being that we're reorganizing staff from the National Toxicology Program and setting up kind of that framework, as I mentioned earlier, of who's reporting to who and who's doing what. But we're also establishing these advisory committees and making sure that they're running and getting them going. The second big project is the research planning phase. So this is very principal investigator heavy and making sure that we're establishing a framework from which to receive data and making sure that we've established goals within our program that we're trying to meet. And then contractor activities is more about issuing contracts and making sure that whatever program we put forward is reviewed by an institutional review board. And at the very end of the first year, we're going to review all the processes that we've gone under and make sure that we're abiding by indicators and by the requirements set out by the National Institute of Environmental Health Sciences. So I've illustrated kind of the problem and how the AACT is in response to that problem and how we're going to operate as a program. And at the very end, we're going to talk about costs and how much that's going to result in terms of funds. And so as you'll see, the first year is divided pretty evenly between funds allocated to the principal investigator and program coordination. And that's because a lot of our first year is about logistics and planning and making sure that we have that framework to receive data. And then about half is allocated towards contractor activities because we will start collecting data in the first year. And so in total, that first year program budget is estimated to be at $1.7 million. As a whole, the program spending looks a bit different. As I've mentioned earlier, years 2 to 4 is where the bulk of that data collection is happening. So a lot of funds are going to be devoted to contractor activities. But it'll also be supported by funds devoted to the principal investigator and the program coordinator. And so in total, over the 5 years, we're imagining that we're going to spend about $17 million. As I mentioned earlier, a lot of these, the entirety of these funds is supposed to be coming from mining firms that are already operating in Appalachia. And so at the very end, important to note is how we're going to make sure that we're doing a good job and what does that look like. And so there are two big themes that we're going to use to evaluate ourselves and making sure that we're holding ourselves accountable. The first being logistically, how is our program running? Is our staff meeting the responsibilities that they said they would do? And then the second component is the data that we're collecting itself and the health risk assessment meeting out the goals that we set out earlier in our quality assurance plan and being collected in a legitimate and transparent way. Regardless of what relationship we determine and what that health risk assessment looks like, at the end of the day, we'll know that we've done a successful job if A, we've determined a relationship at all, and B, if whatever processes we use to parse out that relationship is done in a transparent way that engages the community and is accountable to those who have a stake in our research. So if you have any questions, please don't hesitate to ask. Thanks for your time.
Thank you for being so amazing. So my question is, what financially are you going to do for the workers who can't do their job because of the permit moratorium?
So the permit moratorium is directed towards people or firms that want to mine in Appalachia but who aren't mining currently. So in terms of jobs, people like the future people's jobs might be affected by that, but people who are currently working won't be touched by this policy. But you allude to a bigger question of like funds or how this bill might affect jobs in Appalachia in general, which I think is really important. And jobs have been declining in the mining industry in Appalachia, and that's like a tenuous, tricky relationship that we have to address that we're not quite sure how to do. But I think you pointed to a bigger trend that is inherent in this bill and very tenuous.
Thank you.
Okay.
I was wondering if you could speak a little bit more about the health impact assessments that you're planning to do, because I know in your map you mentioned looking at uterine cancer, which is not something that you typically associate with mining.
So your question is what are you
looking for, I guess, in your health risk assessments?
So that's a great question. Thank you. And I think part of that would be determined in our first year when we're doing that lit review and seeing what kind of data has been done. But from the research that we've done over the past 2 semesters, it seems like there are a lot of key indicators that we might be looking for would be premature births, incidences of those cancers that I've indicated earlier. And that's usually done by a self-reporting mechanism. So people will go to people's doors and knock on them and say, hey, what's going on? But also lung cancer, and heart disease are some of the red flags that have gone up so far in research. But I'm sure that there are others that I haven't touched on right now. That's a good question.
Any other questions? Any final questions?
Thanks, Alisha. That was really great. I was just wondering if there's other resistance to mountaintop removal mining besides health impacts that, other opposition to, maybe environmental impact or just, scenery, landscape, recreational activities that plays into this. Thanks.
Alex, that's a great question. Yeah, there's a lot of pushback from communities. The community is very divided about this issue. I feel like mountaintop removal mining is inherent in the identity of these local communities. It's been a source of income for a lot of people, so they're very resistant to oppose it. But you're right that a lot of community groups are also saying that their environment has been damaged, that they can't live in these places anymore. So from an environmental perspective, that issue has definitely been raised, but I think more the health perspective is very compelling and something that people really can't ignore. So that's kind of how it's played out so far.